Assalamu alaikum everyone. Today I'm going to talk about guillain-Barre syndrome. So the another name for guillain-Barre syndrome is the infectious polyneuroiditis. And guillain-Barre syndrome is abbreviated as GBS. So there is a condition in which the immune system attack on the peripheral nervous system. Now, what are the signs and symptoms of the Guillain-Barre syndromes? Initially, there is numbness and tingling and pain at the back, and this is then followed by weakness of the muscle in the hand and feet. And this weakness of the muscle is bilaterally involved, in which both sides of the body is involved equally. And this weakness of the muscle then progress to the arms, the legs, and to the upper body. And there may be involvement of the muscle of the eyes and involvement of the muscle of the neck and face. And there may be cardiovascular system involved, in which the heart rate may drop and the blood pressure may fall down. So when we examine the patient of GBS, the reflexes of the patient of GBS will either be reduced or it may be absent. When it is reduced, it is called hyporeflexia, and when it is absent, it is called areflexia. So in about 15% of the cases, the respiratory muscle of the patient may be involved, which is a life-threatening condition in which the patient should be mechanically ventilated. So the autonomic nervous system may be involved, but the autonomic nervous system of the bladder and the anus is usually not involved. So now, what are the causes of the GBS? The cause of the GBS is unknown, but about 2/3 of the cases, first infectiously, the patient can develop the GBS. So when a patient has gastroenteritis or upper respiratory infection, the patient can develop the GBS. And when a patient is infected with Campylobacter jejuni, when he or she is infected with cytomegalovirus or the varicella zoster virus or the dengue virus or the Zika fever or Zika virus disease, the patient can get the GBS. Now, how to diagnose the GBS? When you go to diagnose the patient, always follow the sequence. Always take the history, then do the examination and do the investigation. And history, you may ask the previous infection he or she developed. You may find in examination the hyporeflexia or the areflexia. You may find the facial muscle weakness. You may find the weakness of the muscle of the eyes on examination. So investigation, do the blood test which can differentiate the GBS from other causes of the muscle weakness like the hypokalemia and hyponatremia. And also do the lumbar puncture, which will give you a characteristic picture in which the protein level is raised but the cell count is not raised. So it is a peculiar feature in the GBS. The other test which should be done for the GBS is the anti-ganglioside antibody in the serum can also be raised. And also do the MRI, which will differentiate the other cause of the muscle weakness from the GBS, like the spinal cord compression can be differentiated from the GBS by the MRI. So this can make a diagnosis of the GBS. Now, what are the types of GBS? There are mainly 5 types of GBS. The first type is the acute inflammatory demyelinating polyneuropathy, in which sensory symptom, the muscle weakness, and the autonomic nervous system and the cranial nerves are involved. There are 4 things involved in the acute inflammatory demyelinating polyneuropathy, and it is a type which is abbreviated as AIDP. So the second type is the acute motor axonal neuropathy, which is abbreviated as AMAN. So in this type of GBS, the only muscle weakness is there in the acute motor axonal polyneuropathy. The third type of the GBS is the acute motor and sensory axonal neuropathy, in which the muscle weakness along with sensory loss is there. So the PEP type is the pharyngeal, cervical, brachial variant, in which the muscle of the throat and muscle of the neck and muscle of the face are involved. So the PEP type is the Miller pressure syndrome, in which there is a triad of feature. The first is the ataxia or the incoordination. The second is there is a weakness of the muscle of the eye, and the third feature is the areplexia. So these are the 5 type of the GBS. Now, how to treat the GBS? Symptomatic treatment with the pain and numbness or tingling sensation can be treated. The other 2 method is one is intravenous immunoglobulin, the other is plasmapheresis. In the plasmapheresis, the blood is circulated and the antibodies are extracted from the blood. The second is the intravenous immunoglobulin, in which the immunoglobulin are introduced into the body, which neutralize the autoantibody that are produced in the GBS, and which can also suppress the inflammation. So usually the intravenous immunoglobulin is method is preferred because it can be introduced easily and can be available. So this was all about GBS. For more videos, subscribe, like and share. So thanks for watching.